people. And we're going to explore the important role that dental professionals have in prevention, education, and early intervention. Just as a summary, over recent years, vaping has become increasingly common among young people. And whilst vaping can be very effective as a harm reduction tool for adults who are trying to stop smoking, it is not risk-free, especially for children and adolescents who are more vulnerable to nicotine addiction and its effects on developing brains and bodies. Today, the speakers are going to look at the differences between smoking and vaping, current trends in youth vaping, nicotine dependence, and emerging products such as nicotine pouches and THC vapes. We're also going to discuss the evidence around the oral health effects of these products, including their impact on periodontal health, caries risk, oral tissues, and potential long-term concerns. Importantly, we're going to consider how dental teams can have effective, non-judgmental conversations with patients, recognize signs of dependency, deliver very brief advice, and signpost patients where appropriate to support services. The key message throughout this session is that smoking remains significantly more harmful than vaping, but neither is harmless. And as dental professionals, we are in a unique position to educate, support, and safeguard our patients, particularly young people. Hopefully by the end of the session, you'll feel more confident discussing vaping and smoking with patients, understanding the oral health implications, and knowing where and how to refer individuals for further support. So I hope you all enjoy the presentation, and I'll hand you over to Amy and Alice. Thank you very much.
Perfect. Thanks, Don. That was great. My name is Amy Warburton. Thank you for joining today. I just want to say first and foremost, I can't see the chat when I am screen sharing. So if you do have any questions, please do pop them in the chat, or anything that's not working technology-wise, please just raise your hand, and that way I'll be able to see it. We do have people monitoring the chat as well. Like I said, my name is Amy, and I am the vaping lead for CGL Eclipse. It's always a funny title when I tell people, and sometimes they think I'm promoting vaping, but what I actually do is work with young people with nicotine dependencies primarily. My work recently has kind of evolved into looking a little bit more at vaping as a vessel and looking at other substances that we see in vapes as well, such as THC, which Don mentioned. So I'll be delivering kind of the harm reduction and kind of how to have those conversations with our young people today. And I'm going to hand over to Alice now to do a quick introduction.
Lovely. So hi everyone, thanks for joining today. My name's Alice. I'm an academic clinical fellow and a dental core trainee in Manchester Community Dental Service. So we see lots of adults and children with additional needs, lots of vulnerable patients. So definitely within our service, learning and about this has been really valuable to me. So hopefully we can share some useful tips on very brief advice and different effects of vaping on the body today for you and on oral health.
Perfect. Thanks, Alice. Before we move on, I'm just going to say what CGL Eclipse are, because I'm aware that you may not all be familiar. So CGL Eclipse is the Young Person's Drug and Alcohol Service in Manchester. We work with anyone from the age of 5 to 25. I specifically work with young people with nicotine dependency, but we do also support other substance use as well. So Don gave a really comprehensive overview of what we're going to be speaking about today, but I'll just run you through it really quickly. So we're going to talk a little bit about the new Vaping and the Tobacco and Vapes law, nicotine dependency, vaping prevalence, vaping substances other than nicotine. We're going to talk a little bit about nicotine pouches as well. Alice is going to jump in and discuss oral health impact of vaping. I will talk a little bit about oral health and smoking, and then we'll go on to our very brief advice and our harm reduction before discussing referral pathways and an opportunity for a Q&A session at the end. Don's already mentioned the learning objectives, but if you do have any questions throughout, or you feel that we've not touched anything, please do let us know in the Q&A session, and we can go through it again. And hopefully by the end of the session, you will feel confident in communicating, particularly with young people, around vaping and signposting going forwards. So we'll touch again quickly on our key messages. Hopefully you're all familiar with what a vape is, but I'll go through it again quickly. So vaping is the use of an electronic device which is used to inhale vapor derived from a heated liquid. These products use an e-liquid that usually contains nicotine, which is derived from tobacco, as well as a variety of flavourings such as propylene glycol, vegetable glycerin, and other ingredients. These base ingredients may be non-toxic when ingested orally, but researchers don't have enough long-term evidence about how safe they are when they're vaporized and inhaled. That's something that Alice will probably touch on as well, and I will throughout my training, is that because vaping has not been around for a significant amount of time, a lot of the research is still coming out around kind of vaping and its long-term effects. However, we do know that it is still safer than smoking, as we've previously mentioned. So, as I said, smoking is significantly more harmful than vaping, and this is due to the presence of around 7,000 chemicals in tobacco smoke, including toxic carcinogens that lead to disease and early death. We are seeing, unfortunately, the perceived harm from vaping as increasing, which is positive. However, 63% of young people believe vaping is as or more harmful than smoking. So we do want to be clear when we're having those conversations in clinic or with young people or with adults that smoking is still significantly more harmful. It's really difficult to compare like for like, but if we wanted to do some brief comparisons, a cigarette requires around 160 to 320 puffs to smoke. But popular vapes such as Elf Bar, Geek Bar, you may have heard of a Hayati or even Velo as well, are around 600 puffs, or for the refills too. But vape puffs are not the equivalent to cigarette puffs. Vapes do contain less nicotine than a pack of 20 cigarettes, and a standard UK 2 milliliter disposable vape has 40 milligrams of nicotine, whilst a pack of 20 cigarettes has around 250 milligrams, which is over 6 times more. Nicotine absorption does, however, vary for both smoking and vaping, depending on usage rather than just content. And what we see, particularly with young people vaping or vaping in general, is we see a pattern kind of a little bit more like a grazing pattern rather than kind of a routine in terms of their vaping. Because a vape is much kind of easier to use, you don't have to go outside, roll a cigarette, there's less kind of work in using it. What I see with my young people in particular is they're using it kind of throughout the day daily, so they're kind of getting that more regular nicotine intake through their use.
Hi, can you please?
I'm gonna show you a video now, which is from Charlotte Bryan, who is the nurse manager at Be Smoke Free, and she explains really well kind of how the similarities and differences between vaping and smoking.
Hi, can you please introduce yourself?
Yeah, of course. So I'm Charlotte Bryan. I'm the nurse manager for Be Smoke Free Manchester, which is a community stop smoking service based in the city centre that takes care of all ages that want to give up tobacco or smoking it.
Is it fair to say that vaping is just as bad as smoking?
Well, it's a really interesting question. So there isn't as much evidence about vaping on its long-term effects and how it affects the body and minds of people that are using it. We do know that smoking is very, very harmful, and it is probably one of the worst things that you can do for your health and your body. Vaping still uses nicotine, which is a highly addictive substance, and it has its own effects. You take in a lot more nicotine from vaping than you would do from smoking. However, as part of a treatment plan, such as what we do at our service, vaping can be used as a tool to help people quit. But that would be someone that's an adult and someone that has been smoking for a very long time. So anyone who hasn't smoked, or they are a young person under the age of 18, they would not vape. And there is some harms associated with vaping that go along with that.
Do you think vaping should be banned altogether?
I think that vaping for under 18s, while it is already banned, should definitely be very discouraged. Again, as I mentioned before, there are some harms associated with under 18s vaping that are really, really harmful, and we don't want that to happen. In the grand scheme of things, they can be used as a harm reduction tool as part of a smoking cessation treatment plan. So I don't think they should be banned completely, because for some people the only option they have is vaping instead of smoking, which is a little bit safer for people like that.
If people want some support, how can they get in touch with Be Smoke Free?
We have a link on the Change Grow Live website. You can also just Google Be Smoke Free Manchester, and there's links on the Manchester City Council website to come and talk to us as well, and our phone number's on there.
Perfect. So I think Charlotte kind of explains all of that really well. I'm going to talk a little bit now about the tobacco and vapes bill, which I'm sure you will have heard of. There's been quite a lot of discourse around this as well. So the tobacco and vapes bill introduces quite a lot of changes. Okay. So I'll run through some of the main ones really quickly. Okay. So it will be illegal to sell tobacco to anyone born on or after the 1st of January 2009, and this age will effectively increase year on year from 2027. We'll also see a ban on advertising and sponsorships of vapes and nicotine products. I'll talk a little bit about it later, but a lot of young people are exposed to vapes due to kind of advertising or where they see it on social media or online, so hopefully that will mitigate some of that. We're going to also ban bright colours, sweet names, and child-focused branding, and there'll be greater control on the flavours, content, packaging, and design. It will still be illegal to sell vapes or nicotine products to anyone under the age of 18 years old. And it will also prohibit giving out free vapes, as well as ban vape vending machines. There'll also be a new licensing scheme for shops selling tobacco and vapes, and on-the-spot fines and stronger trading standard powers to help stop traders selling illicit vapes or to underage children. There'll also be powers to extend the bans to outdoor areas such as schools and playgrounds, and a new system to regulate products entering the UK market. This is a really comprehensive package of kind of new legislation changes, and it's hoped that it will reduce the youth exposure and appeal, make products less attractive to children, increase the safety around substances and nicotine use for young people, and increase compliance with the law as well. This is just a little bit of a timeline around what we're looking at so far. So as of the 29th of April of this year, the comprehensive and updated definition of tobacco products was implemented. It was made clear that the advertising of all tobacco products, included heating tobacco, is illegal. As of the 29th of October 2026, the minimum age of sale of all nicotine products and zero nicotine vapes will be 18, as well as the ban on vending machines and the ban on free distribution of vapes and other consumer nicotine products. As of the 1st of January, as I mentioned, this is when the generational tobacco sales ban will come into effect, and June 2027 will see that ban on advertising and sponsorships. Between 2077 and 2029, we'll see kind of the results of the following public consultations. This will implement the final changes and restrictions on flavours and packaging, retail licensing and registration schemes, and the introduction of smoke-free heated tobacco and vape-free spaces as well. So why does this matter? I'm going to talk a little bit about the most up-to-date statistics around this. There will be links to all of this research at the end of the PowerPoint as well, which you are able to look at in your own time. So vaping amongst 11 to 17-year-olds has actually plateaued at 20%, which is an estimated 1.1 million children between 2023 and 2025. Current vaping has also plateaued at 7%, which is around 400,000 children. This followed a doubling from 3% in 2021 to 7% in 2022. And regular vaping, which counts as more than once a week, has also plateaued in 2025, after rising from 1% in 2021 to 4% in 2023. 3%, around 160,000 children, currently vape daily. And we see that experimentation, which is the most common form, sits at around 11% of children in the UK. We also see that prevalence increases with age. So 11 to 15-year-olds, we see about 16% have ever vaped and 5% currently. 16 to 17-year-olds sits at 30% and 12% who currently vape. And 18-year-olds, 28% have ever vaped, and 15% currently vape. So we do see that kind of rise. We see that kind of 16 to 17-year-olds, we actually have a slight increase compared to the ever vaped at 18 years old, but more over 18s currently vape as well. Anecdotally, we are aware of pupils as young as 8 years old accessing and using vapes, and we've also seen a higher proportion of young people with learning disabilities who vape. My work, mostly I kind of work with secondary school pupils, but I have worked with primary school pupils. The general cohort that I would say that I work with are kind of year 9, year 10, year 11, but anecdotally, again, most of them have started in kind of like year 6, year 7, year 8, and it gets to a point where they then need my support when they're reaching those higher years in secondary school. This is just a nice kind of graph to show why young people kind of choose to vape. So we see, just to give it a try, so curiosity and interest is a really, really big driving factor for why young people do, especially when they may see their peers using it, they may see older friends or family using it, they smell nice, they look nice. That interest is only natural and clearly reflected in this. Other people using them, so peer pressure can be a massive thing. One of the things that I see in practice is when young people use their vapes in school, it becomes a little bit of a social activity. So they may go to the school bathrooms at break or lunchtime, and that can be quite isolating if a young person is the only one not vaping. So obviously by proxy, that they may be exposed to it more. They also like the flavours. They find that it helps manage their stress and their mental health. They enjoy it and they think they look cool as well. So those are the main reasons. Regarding the mental health as well, I find a lot of my young people, or young people in general, do find that they feel that it does benefit their mental health. So I spent a lot of time kind of explaining how nicotine actually impacts the brain. And whilst it may feel like it's benefiting them in the short term, it actually makes them feel worse in the long term. So obviously you're not going to have extensive periods of time to kind of relay that information to your young people who you see in clinic, but just really briefly explaining to them how it might make them feel can be really, really effective in a non-judgmental way as well. That kind of brings me on to how nicotine affects the brain and body. So a Nick buzz, a Nick rush, they might say they're kind of fiending for it as well, is a combination of the stimulant effects of nicotine along with a lack of oxygen to the brain. First-time users may feel lightheaded when experiencing a nicotine rush, but other effects also include increased heart rate, alertness, and nausea. When my young people tell me that they're using nicotine to help manage their anxiety, explaining the increased heart rate and how that can also make them feel more anxious in turn can be really helpful, and kind of highlighting to them it's a little bit of a vicious cycle in a sense. It's really important to explain to our young people that if they do experience heart palpitations, chest pain, struggle to breathe or anything like that, then they do need to be kind of seeking medical support with that as well. A lot of schools will have an asthma nurse or a school nurse where they can potentially be signposted to as well. Nicotine activates the reward system, which reinforces drug-taking behaviour. And the National Institute on Drug Abuse warns that vaping, because of nicotine addiction, may make other drugs like cocaine and methamphetamine more pleasurable. I think one of the things to think about with this is when young people are using nicotine or using a vape to help regulate or manage their emotions in particular, they're forgetting those healthy coping mechanisms, which might take longer to make them feel better, but actually are a lot more sustainable in the long run. So that's kind of where they then go for that really quick short fix without kind of then having those established coping mechanisms which will help them going forward as well. Vaping can also aggravate your airways, so if you do have asthma, you should not be vaping, and instead consult with a GP or stop smoking advisor about other forms of nicotine replacement therapy. If they are a young person, again, I'd be referring them to the nurse, and you can refer them to Be Smoke Free if they're smoking tobacco, and that can kind of next steps can kind of be looked at in terms of reducing that risk for them. For more information and guidance, you can view the National Centre for Smoking Cessation and Training, which is the NCSCT briefing guide, which has lots and lots of information around this. So some of the things that we would think about when we're looking at the signs of dependency around the young person is feeling anxious if they're running out, increasing their use, so needing to vape every day, waking up in the night to vape is quite an important one as well. Prioritising buying vape products over other things, even if you can't afford it. Planning activities around being able to vape or avoiding activities if you can't vape. So not going to a certain person's house because their mum doesn't let them vape, or not wanting to go on a family holiday because they won't be able to vape as well. Potentially reducing their normal kind of hobbies because potentially vaping is stopping them from doing that. Increasing the amounts or strengths of nicotine, using more regularly throughout the day, or irritability when unable to vape as well. And I do talk to my young people quite a lot about this vicious cycle, that nicotine does activate those dopamine receptors, as I mentioned, makes them feel really good in a really short amount of time, but they crash very quickly. So what ends up happening is that level of normal they might be feeling, they then end up needing nicotine just to feel that kind of daily level of kind of normality. So what then ends up happening is when the nicotine leaves their system, they end up needing more and more nicotine just to feel normal, let alone then help them manage their emotions, especially when that's their main coping strategy as well. A couple of harm reduction tips that I often give my young person is, if they are using a maximum strength nicotine vape, is to try and reduce that to a lower strength. Not vaping as soon as they wake up, and not vaping as the last thing they do before bed. This is because quite simply, like, stop vaping as soon as you wake up kind of sets that path for the rest of the day in terms of wanting to use it more and more throughout the day. Nicotine is a stimulant as well, so using it right before bed, it makes it harder for them to go to sleep as well. So that can impact their sleep hygiene too. So how do we communicate this with young people? It can be really difficult, and young people can be very, very kind of wary when we do try and communicate this with them. I think a lot of the time young people feel like they're going to be chastised when we have conversations around substance use or nicotine or vaping. So it's really important to be open and clear in your communication, that you are not telling them off, but you're empowering them with the advice and ability to make an informed decision and be a little bit safer with their use. So when you're in clinic, it's important to be aware of patient dynamics. Who is in the room with them? How have they interacted with that person, if there's a parent or a carer with them? And are there any safeguarding concerns that you know? What we don't want to end up doing is kind of calling a young person out and then them then having to have a very difficult conversation with a parent or carer. Obviously, a conversation may have to be had, but just use your professional judgment about kind of what the dynamic looks like in that room and how to have that conversation as well. Be curious and open. Young people often feel most shut down if they feel under pressure or judged. So asking open questions, being curious, being intrigued, thinking about, what can I learn from you? How are you going to explain this to me? Terms of what their use might look like, especially if you've seen signs of use in clinic. And then again, reminding them that you're not getting them in trouble, or you're not catching them out. You just want to understand what's going on so you can give them the best advice and next steps. Some questions you might want to consider asking would include: have you ever tried to stop vaping but found it too hard? Does your mood rely on if you can or can't use a vape? Is anyone you know worried about your use? Or do you ever vape anything aside from nicotine as well? So that would be a good chart to kind of think about those safeguarding concerns. Are they kind of maybe smoking THC or anything else in a vape as well? Considering maybe where they're getting their vape from as well. And again, it's just being patient-led with that conversation, but making sure you're able to kind of use your professional judgment and feed in some of that harm reduction advice as well. A really, really quick acronym I think is a really useful tool to use with your young people is the START acronym. So kind of starting their nicotine reduction journey, we like to put it. So setting your goals and identifying a time frame. This might be as simple as I am not going to vape within the first hour of waking up and the last hour of going to bed. And I'm going to reduce this each week, so then it's 2 hours and 3 hours, etc. Thinking of other activities or ways to manage your cravings. So what I find really helpful is vaping triggers a lot of our different senses. Yeah, it's the physical sense of kind of not only just breathing in, but holding something, using it as a fidget device. It's the smell, it's the taste in particular. And what we can kind of think about doing is replacing some of those habits. So they're reducing their nicotine and they're reducing their vape consumption, but we're replacing it with a healthy habit or something that helps them feel a little bit calmer. One of the things that young people struggle the most with is just going cold turkey or taking their vape away from them entirely. And this is due to the fact that it is kind of perpetually with them if they're using regularly, they use it as a fidget toy, etc. So some of the things that a lot of my young people find helpful are using chewing gum or making sure it's sugar-free, ideally, drinking water, listening to music, kind of replacing kind of those habits. So even playing kind of Xbox, a lot of them find really helpful. Avoiding triggers where possible. So if all their friends go to the school toilet and they vape in the school toilet, not going with them. If they normally go to a specific shop to buy a vape, don't go to that shop. Go to a different shop on their way home from school. Remembering to pause and leave gaps between their use can be really helpful. So prolonging that use and using less each time they use as well. And treating themselves and rewarding themselves for their progress. Some young people have a really open conversation with their parents and carers, and they might kind of say, well, if I quit vaping by this time, I will be able to go out for a meal or something like that. But it might be something small of like, I'm not going to spend the £3 on a vape or vape liquid. I'm going to save that up and at the end of the month be able to buy myself a Mackey's as an example that some of my young people kind of work towards. It's really just about kind of what is important to them and seeing their life outside of using a vape as well. So this kind of brings me on to some different types of vapes that we see. Recently, there has been a trend of a new kind of healthy vape, which are marketed as a healthy and safe alternative. However, whilst they do have no nicotine, this does not mean they are safe, and companies lack the evidence needed to back claims which support collagen or caffeine-infused vapes. Some of them we might see described as being able to vape their vitamins or using it to kind of help them sleep before bed. The safest thing, though, for a young person to do is to reduce their vaping habit and replace the physical habit by using a vape with using something like chewing gum or a fidget toy. It's completely understandable why young people might find this really helpful or perceive it to be really helpful. But again, it's about highlighting the unknown risks of these products. And again, you're kind of just you're kind of transferring the dependency onto a different unknown product. So it's better to just go and use those reduction and those distraction techniques, which will benefit them in the long run as well. I've already mentioned nicotine pouches, but I'm going to speak about them briefly. One of the reasons that I'm talking to you about this today is we've seen a rise of young people using nicotine pouches. And part of the reason for this is that there's currently no legal age limit. However, the tobacco and vapes bill will be putting one in place. So it's anecdotally referred to as snus by many young people. However, there is a difference between snus and nicotine pouches. Snus traditionally contained tobacco, and their sale has actually been banned in the UK since 1992. Nicotine pouches do not contain tobacco and are legal to buy in the UK. However, there are rising concerns relating to the strength of nicotine and frequency and volume of usage. With my young people or who are particularly dependent on nicotine, we see them using nicotine pouches in conjunction with their vape use, which is a significant increase in their nicotine use. Part of the reason for this is it can go undetected, so a pouch is normally placed in the upper lip and gum for up to 30 minutes. And we see a rising youth appeal due to the advertising of flavours, the packaging, and obviously the space.
Might be able to. I'll give it a go. I'll be all right. Yeah, I think I'll.
The disposable vape ban, also we saw an increase of use due to the rise. We saw an increase of use in reaction to the disposable vape ban as well. Nicotine pouches are not endorsed as a form of nicotine replacement therapy for anyone, though, and it's important to highlight that when you're having those conversations with your young people. I do have a lot of young people asking, should they switch to nicotine pouches? And the answer is no. Alice will talk a little bit about it later, but nicotine pouches also have some quite significant impacts on their oral health. And again, it's the nicotine that they are still consuming, and often in quite high amounts with these. So we are lucky in the UK that we do have tight restrictions and regulations on legal and illicit vapes. However, we do still see some slipping through the market, and that's why the tobacco and vapes bill is increasing greater kind of jurisdiction for trading standards to try and I've lost my train of thought, to try and stop this from happening. So if we think about it really basically, the maximum tank size for e-cigarettes is about 2 millilitres and a maximum volume of 10 millilitres for the nicotine containing refill containers. Nicotine strength for an e-liquid can be no more than 20 milligrams, and the health warning must explicitly say, with this specific wording, this product contains nicotine, a highly addictive substance. Packaging should also be tamper evident and child resistant, and labels must not resemble food, sweets, or known brands or logos. All legal vapes must be notified on the MHRA website and must not include any ingredients such as vitamins, stimulants like caffeine or taurine, colorings, and chemicals that are carcinogenic, mutagenic, reprotoxic, or teratogenic. If we're thinking about the difference between a disposable vape, which has now been banned for over a year now, and a reusable vape, I like to consider the 3 R's. So this is refillable, rechargeable, and replaceable, something that's easy to kind of communicate with our young people too. This means that the e-liquid container needs to be refillable, or a pre-filled pod can replace it. The battery needs to be able to be recharged without modification, and the coil must be able to be replaced. This can also be done with a pre-filled pod, and this should be done every 1 to 2 weeks. If a vape starts to taste burned or smell burned, this may be because the coil needs replacing. So it's important to remind young people that needs to be changed as well. If the coil burns as well, there are other fire risks associated with that too. THC vapes. So we have also seen an increase in use of THC vapes amongst young people in the UK. Now, I say THC vape with a little bit of a caveat that we often don't know what's actually in these vapes. And part of the reason for that is just how cheaply they're getting them and the other substances that may be mixed into that. Okay. What I'm seeing with young people using THC is often they may have been using nicotine for a prolonged period of time and looking at trying something new. Because THC vapes are colourless and don't smell, it's easier to use them than smoking cannabis, which is why they kind of have that appeal for young people. Common effects of THC vapes include feelings of relaxation or euphoria, improved mood, increased sociability, altered sense of time, reduced anxiety in some users, and increased appetite. Many of these effects are similar to those of herbal cannabis. However, THC vapes tend to be much more potent because the CBD has been removed as part of the manufacturing process. Again, I caveat here, that would be kind of some of the effects with a genuine THC vape. But the vapes that young people are predominantly accessing at the moment have a variety of other substances in. And one of the most significant risks, as I just mentioned, is the large number that are containing synthetic cannabinoids. In 2023, it was found that 43% of THC vapes tested in Manchester contained at least one synthetic cannabinoid, with some containing a blend of various synthetic substances. You might be familiar with kind of the word spice, but there are numerous other synthetic cannabinoids such as K2 or Mamba as well. One of the things we're seeing, unfortunately, with young people who may be using THC vapes daily are very severe withdrawal symptoms when they stop suddenly. So if a young person is using a THC vape, you can refer them to their local drug and alcohol service. We'd also be making sure that they were aware that, one, they don't know what's in that. Two, to always go low and slow if they are using it, because simply we don't know what's in it and they can never guarantee it either. But also if they experience any form of, again, vomiting, passing out, dizziness, blacking out, either from withdrawals or when using, then to seek urgent medical support as well. It's important to remind young people that they will never get in trouble for seeking medical support, because that can be a big barrier to them getting the support they need, especially when they may be in a little bit of medical crisis. A genuine THC vape, just for reference, would cost around £80 to £100. So anything less than this means it is likely synthetic. Most young people in Manchester are paying about £10 to £15. So we can kind of hypothesize and from experience that they are not genuine THC vapes. It's pretty easy to report vapes and also report shops if you are aware of somebody distributing them. So you can do this by going on the MHRA website, firstly, to check if a vape is legal. You can check the packaging warnings on gov.uk. And you can also report underage selling to young people or selling illicit products by emailing trading standards on that email there, or by calling Citizens Advice as well. I've linked the how to report guide there as well. It's also important to remember, as I said, that any adult who buys or attempts to buy tobacco, cigarette papers, or a vape on behalf of somebody under the age of 18 commits an offence called proxy purchasing. And also, if you're ever in any doubt that a vape is legal or illicit, again, you can check that MHRA website where it will be registered. I said quite a lot already about some of the patterns of why young people might vape, but I'll just go through this again really quickly. Some of the main reasons we might see it are peer pressure, stress relief, the flavours, being bored, using it as a self-medication, the price because it's cheap, media influence, so seeing people do it online, and the kind of acceptability or normalization of it as well. Some of the main patterns I see in our young people, though, is that they may see peers using it, or friends at school, older children, older siblings, or family. They might kind of begin to borrow a friend's vape at school or when hanging out. They might want to just try it. The flavour sounds nice, it looks cool, and maybe they've seen some kind of like TikTok people doing trends and kind of tricks with them. They realise that this makes them feel happy and relaxed, and also how easy it is to buy at a shop that they kind of know about or their friend might offer to buy it for them. However, they may only get a certain amount of pocket money a week. So why would they buy a legal one, which is around 600 puffs, when they could buy a 4,000 puff one? This means that they can also use it more socially and don't have to be as mindful about their use. It's important to mention here that a 4,000 puff vape would still be illicit, but they are still kind of kicking about. And our young people often aren't aware of those nuances in kind of the difference between a legal and an illicit vape, which is why it's important to kind of provide them with that information too. Very quickly, when they're using nicotine regularly, it may become a boredom breaker or a tool to help self-soothe. And they kind of get into this cycle of using more and more regularly, and kind of becoming then kind of getting that dependence on their nicotine vape. So that's kind of a general pattern of what we see, but obviously every single child is different. Their reasons for using are different, but at the end of the day, there will always be a reason for why they are using. And it's important to just be mindful of that when you are having those conversations with your young people, and delivering that brief advice.
Hi, can you please introduce?
I'm just going to show you a case study now of a young person and talking about their vaping journey.
Hi, can you please introduce yourself?
Hi, I'm Evelyn and I'm here to share my personal experience with vaping.
What made you want to start vaping? What got you going?
I was 13, very young, and it was an older friend who kind of peer pressured me, and that's how it all started.
Yeah, simple things like that can make you pick it up, can't they?
Yeah.
So when it came health-wise, mental, physical, how did it affect you personally?
It affected my mental health really badly, with the addiction side of things, and the physical health I actually got really poorly, and I have asthma and I can't do a lot of physical activity, get out of breath easily. It's just not worth it.
So before you actually started vaping, what do you wish you could have told yourself before you started?
That it's actually really harmful. The effects it would have, I didn't even have to tell the dentist that I vaped. He just knew straight away, and he said, "You have gum disease," and that is because of vaping. So it's not something that everyone actually thinks about, but it does affect your teeth as well.
Especially with what I've learned today, I've learned that it's really, really bad for you and very unhygienic. So it is good to know that beforehand.
Yeah, it is. You wouldn't go sharing a fork or a spoon. So why would you share a vape?
It's a nice way to look at it.
Yeah.
Thank you.
Perfect. So I think Evelyn kind of voices that really, really well. I'm going to very quickly run through some of the effects of smoking and oral health. I'm just aware of time. So tobacco use as smoking and smokeless has significant and well-established impacts on our oral health, and effects range from cosmetic concerns to serious disease outcomes, such as periodontal disease, which has an increased risk of bone loss and tooth loss, impaired healing following dental treatment, oral cancer, as well as tooth staining, halitosis, and calculus buildup as well, alongside a reduced taste and smell. Tobacco use is a major modifiable risk factor affecting both oral health outcomes and treatment success in patients who cease their tobacco use. So we do see a reduced treatment success and increased complications, specifically with implant failure and delayed healing with tobacco users, as well as a weakened immune response, and it's harder to control periodontal infections. You see higher levels of plaque, biofilm, and oral bacteria imbalance, but there are opportunities for intervention. Smoking cessation improves healing and treatment outcomes and halves oral cancer risk within 5 years of quitting. Practitioners can routinely ask, record, and monitor smoking status, as well as deliver brief advice and signpost to cessation support. The NCSCT follow the ask, advise, and act. So asking the questions of if they smoke, delivering very brief advice, and acting, which will be the signposting to the local stop smoking service as well. I'm going to hand over to Alice now, who's going to give a little bit of a clinical perspective.
Lovely, thank you, Amy. I guess a common theme throughout this presentation is a lot of the long-term effects are unknown, but as Amy's touched upon, things are changing and we are finding out more information, and there's lots of upcoming research. So I thought I'd shed a bit of light on some of that and give a bit of clarity on what we can help advise our patients. So what we do know is that vape use is becoming increasingly common in our younger population. As Amy touched upon, children as young as 11 and 12, anecdotally even younger than that, which is a big shock really in primary age children. There's also prevalence in children with special educational needs, and it's been linked to increased use in ADHD, as Amy touched upon as well, thinking about the habits and the sensory associations with vape use. When young people are starting to vape as well, it does mean that they're 3 times more likely to initiate smoking in the future. And as Amy touched upon as well, there's that association between vaping and lots of substance use. So we don't want it being initiated, as it is a gateway for many other substances. Next slide, please. Perfect. So I've sort of broken it up into different oral health impacts. So I'll start with the periodontal impacts. So as we know how nicotine works, it's got vasoconstrictive effects, which impairs tissue repair. And with some vapes having very, very high amounts of nicotine, that's how it can be very damaging for the gums. It's linked to immunosuppression and inflammation, so increasing the risk of gingivitis and periodontitis. There's also research that suggests that non-smokers do have much better plaque control and reduce bleeding on probing with smokers and vapors as well. And also some evidence to suggest that there's more clinical attachment loss in vapors compared with non-smokers. And again, with the mechanism of gum disease, there is similar biofilm findings between vapors and smokers as well, suggesting that that mechanism of action is quite similar. But I guess an important point to remember across this sort of the ideas throughout this presentation, just on this flowchart here, is that smokers have the biggest risk for a lot of oral health impacts, including gum effects, but vape users, it's still a more significant risk than non-smokers. But yeah, it's just important to remember that I guess. Yeah, next slide, please. So looking for the direct link between caries and vape use, there's not a lot showing that directly in the evidence. So there's some with a low certainty suggesting that there is an increased caries risk. However, I delved a bit deeper and there is a definite link between xerostomia and vape use. So we know that people who are using vapes are more likely to have dry mouth, which is a direct risk factor for caries. And the longer that they're using the vape for, the more likely they are to have a higher risk of dry mouth as well. And interestingly, the type of vape that children and young people might be using also has an impact on caries. So the non-flavored vapes are non-cariogenic, but those flavored vapes are actually cariogenic. So some of those brighter coloured vapes, the more eye-catching colours, and some of the more popular reported flavours in children and young people are actually directly able to cause caries. As Amy said, if it's used straight after waking up or just before bed as well, that can be a really harmful time to be using that vape, especially vaping being associated with frequent use throughout the day. So when we might warn our patients to have limited sugar attacks, regular vaping through the day can be really harmful. Next slide, please. So just to touch on mucosal impacts as well. So burn injuries are very common with vapes. So this might be from excess use, or it might be from sort of damage of the vape. So for example, if the coil's a bit burnt and they can sort of explode and cause a burn that way, or leaking of internal chemicals as well. So this can lead to oral ulceration and irritation. Next slide, please. So just to touch on pouches as well. So Amy did a lovely summary on what's contained in pouches and the difference with that and snus. But what we do know is that they typically are used for much longer than they're recommended, especially with children and young people, and they're often bought in concentrations which are much higher than advised. There's an interesting paper here as well that shows prolonged use. There is reports of mucosal changes, such as leukoplakia, when used in similar positions as well, like in this photo, they can cause localized gingival recession due to vasoconstriction and sort of inflammation of the tissue in that area. And yeah, in a recent local survey, it's reported that up to 1 in 20 young people have been using nicotine pouches as well. So I thought that was an interesting stat. Lovely. So just a link to oral cancer as well. So we've not known the effects of vaping linked to oral cancer for a long time, really. But I thought I'd outline here, so briefly what's in a vape, or some different compounds that are in a vape that are really damaging, such as nicotine volatile organic compounds, polycyclic aromatic hydrocarbons. So just lots of components that are not very good for us, especially when inhaled locally to our oral, close to our oral mucosa. So there was an interesting recent paper I found from March 2026 that does actually directly link a lot of the effects of vaping to cancer risk as well. So listed here, like epigenetic changes, DNA damage, and oxidative stress. So some specific biochemical effects of how it might be potentially linked to malignant transformation, which is really important. Next slide, please. So just to summarize some impacts of vaping on the body outside of the oral health as well. So it's linked to cardiovascular effects, so increased heart rate and blood pressure. As we can probably infer as well, it's poor effects on the lungs. So it's been linked to reduced lung function and an increased risk of asthma. And that's been linked as similar of cigarette use as well with the local inhalation. Vaping's also linked to poor mental health as well. So lots of studies that link it to depression, even thoughts of suicide, an increased risk of accidental injury as well, like those burn injuries discussed earlier. Interestingly as well, as Amy said, if it's done before bed, it's commonly reported alongside poor sleep, especially on the weekends when that might be associated with alcohol or going out with friends. And interestingly as well, linked to fertility as well. So I thought that was just an effect I would add on because I wasn't aware of that. So lots of new evidence coming out that do support the fact that it is very bad for us and our oral health and our body. So I thought I'd put a summary here. So the importance of very brief advice for our patients. So for children and young people especially, trying to reduce even starting vaping in the first place. So educating on what the harmful effects are. Say if they mention if their friends have been trying it or family members or anything like that, because reducing even starting it can be a really helpful place. Also educating on all the harmful effects. So as we know a little bit more now and more research is coming out, sharing that with our patients can be really helpful and catching these problems earlier on. And also signposting for support services. So we'll share some really useful resources at the end about different signposting services across different areas of Greater Manchester. Lovely. Next slide, please. So I thought I'd do a summary of what our role is and why it's important from our perspective. So as we've discussed, the evidence is limited for the long-term effects, but more evidence is coming out. The knowledge within the youth population about the harmful effects is also low. I've just listed a study here where it sort of demonstrates that the majority of the youth population are aware of the negative effects for the lungs, but only about half have been reported to know about the negative effects for their oral health. So I guess it's our responsibility to raise and educate on that, and hopefully help reduce some of its use. And just the importance of educating our patients and signposting. Lovely. So these are my yeah, clinical references here, so feel free to have a look at those.
Perfect. Thanks, Alice. And I'm just going to round up with our key messages as well. So nicotine is a highly addictive substance and can cause dependency. But it's important to remember that vaping can be a harm reduction tool when used appropriately for adults to stop smoking. If you're working particularly with young children, I find this very helpful to explain to my primary school children, is that medication can be useful for certain people, but they wouldn't take their parent or their carer's medication because it's not meant for them. I know that's kind of a very vague kind of way to explain it, but when we're thinking about our really young, especially primary school children, they do have a good understanding of who medication is for and who it's not for. So explaining it to them like that can be really useful. Vapes are safer than smoking when used in the right circumstances, but are still not risk-free, and no one under the age of 18 should be able to buy a vape. If a young person would like support with their vaping and they live in Manchester city centre, a referral can be made to CGL Eclipse. And if a young person is smoking, they should be referred to the local smoking cessation service, which in Manchester is Be Smoke Free. When you're making a referral to CGL Eclipse, you would go onto this Eclipse website, which is linked in this PowerPoint slide as well. You would go to the referrals here, and then you would put referral for somebody else. If a young person wants to make their own referral, they can also do it too. And then you would fill out the form. It's very self-explanatory, and you would choose this option. So a young person aged 18 or under would like support for their drug, alcohol, or nicotine vaping use. The form takes about 5 to 7 minutes to fill out, but again, a young person can do that themselves, or any professional or parent too. Here are my references and links for the reports that I have signposted to throughout this session. I'm going to hand over to Naira now, who's going to explain a little bit about our offers in the wider area.
Thanks, Amy. So I'm Naira, I'm a programme lead in the public health team at Manchester City Council, and you'll see we've signposted to services for Eclipse and Be Smoke Free, which is Manchester. However, what we have also done is try to collate what treatment support is available around young people and vaping across Greater Manchester. And just to flag that there is no national dedicated funding for vaping treatment and support like there is for smoking cessation. And so therefore the offer will vary across different local authorities. And just so for example, in Manchester is where the substance misuse service. In other areas it could be the smoking cessation service. It could also be your school nursing service, or it could be none. So we have listed that in the slides, and that will be shared following this webinar as well. Still on slides 37 to 33. But just to flag that in terms of those referral pathways, if a young person is vaping nicotine or non-nicotine, the treatment support options are available on slides 37 to 39, and it's by locality, and it's by local authority areas as well. So that's how they've been listed as well. So there's 10 local authorities in Greater Manchester, Manchester being one of 10. If a young person discloses smoking or vaping illegal substances or illicit substances, they can be offered support, and that usually that support is done by the substance misuse service. And again, we've detailed all the substance use services across Greater Manchester as well, because again they'll vary in terms of who's providing that service as well. And finally, if a young person indicates that they are smoking tobacco, and that support is available through the referral to the local stop smoking service, and we've done one link which takes you to the Make Smoking History page, and within that you'll see by locality who's providing that smoking cessation support offer as well. Next slide please, Amy. And that's just to list, and not only have we put down the local authority areas, we've also put in terms of, because they'll vary by what age referral they will take as well, up to, so some will do up to 18, whilst others might do 21 or 25 as well. So the details are there along with the service contact details. Next slide please. registered all 10. And then the next slide will explain the substance use services as well. And we've also included information around key resources that we think might be useful for yourself as professionals. So we've listed kind of generic resources around kind of vaping, so NCSCT, but also change, go, live resources. And we do also have a Manchester Padlet, which is on the next slide, which includes, and that's open source, so anybody can access that outside of Manchester as well. And what we try to do is provide up-to-date details around information around young people and vaping. Amy just got the hovering over the vaping Padlet there as well. I think that's it for now. I think that's a substance misuse service, and that's a local stop service, and we've included additional resources as well around smoking as well, where we've got other areas that have shared their information on that. A final slide, and I suppose it's to open up just around kind of Q&A as well. So I suppose it's over to yourselves. If you've got any questions for Amy or Alice, you can put them in the chat, or likewise, you can just kind of raise your hand and we can take questions.
Okay, I'll jump in there then. If there aren't any questions at the minute, there might be in a minute or two. But can I just thank all three of you for an excellent presentation? I think it's a superb educational tool. And what I would hopefully ask all of our colleagues who are on this particular presentation, please do share this excellent resource with the rest of the team, because the more the people know, the better. Now, we had a big conversation. It is unfortunate that each locality is different. What we'd ideally love is it for all to be the same for Greater Manchester, but as things stand, that isn't possible. But I think what Nair has done there is absolutely brilliant. That if you reference the individual resource for your particular locality, I think that's absolutely brilliant. So I'm keen, if there are any questions, if you'd like to put them forward, or maybe if you'd rather put them in the chat, that would be fine as well.
Suppose if there aren't questions as well, I mean, I don't know whether we can put forward questions. I'll be really interested in terms of any teams that actually have, or dentists have actually come across patients kind of on vaping as well. That'd be useful for our understanding as well. We have a question from Stuart Allen.
Yes, I was sorry. I'm trying to come off mute. I was going to ask, as I drive down various different high streets, I see more and more vaping shops or something. Is there some move to step up the licensing of those? I'm afraid I'm old enough to remember when we used to have sex shops selling various things. I don't really know what, because I never went in one, of course. And then they brought in local authority licensing, which really restricted how many there are. Would that be a useful adjunct to all the other helpful work, just cutting off the supply?
So just to respond to that, there is a retail and vapes licensing scheme to be introduced. So the consultation for that will go out in 2027, and then obviously time for that to be implemented, and that will be tobacco and vapes licensing scheme. But there is also work that kind of our trading standards team also do in the background in terms of kind of vape shops and kind of those that are persistently kind of selling kind of illegal or illicit vapes as well. So there are things that can be done in terms of enforcement orders or shop closure orders. So you might have seen that Manchester City Council might have also kind of done a couple of closure notices as well, where these they have been closed and where they're persistently selling illegal vapes as well. And I can link, we've got a Channel 5 documentary, I can link that as well if your colleagues are interested in that as well.
Thank you.
Any other questions, or I suppose any feedback from yourselves around if you know your patients or your clinics, any questions? Are we overwhelmed you with lots of information?
You must have covered all bases. Yeah, sorry, go on.
Yeah, is it worth also mentioning, Amy, because in Manchester we are looking at maybe getting Z cards out to kind of Manchester dentists. So again, we'll be in touch for kind of dentists in Manchester around Z cards. And I know Trafford have also mentioned they have something similar as well. It's in the slides, but we will be looking at getting kind of dentists Z cards out with a QR code for where you can refer to be for Eclipse.
Yeah, so that Yeah, perfect. So that Z card will have the Eclipse details on one side, and then that brief intervention acronym, the START, on the other side as well. So we'll be in contact when they're available to be rolled out in Manchester city centre.
So when you say those are available, will that be you'll be passing those out to dental practices? Is that the idea, or?
Yeah,
Okay, and that's
coordinate,
Manchester.
Yeah, Manchester.
Okay, perfect.
And notice Rolls has just put in the evaluation form in the chat as well, so please do complete it because it'll help us. This is the first that we've actually done in terms of kind of oral health and kind of vaping. So any feedback, we'd be really keen to take that on board. So please do complete it, and I think it links to the CPD as well.
Yeah.
I've just seen a chat, someone has put in the chat that they found that useful, so thanks Priya for that. And again, this links to kind of all those references as well if you want more details. And we are expecting a further ASH survey out soon, usually around about July time, so the 2026 figures. Again, when that's available, we can share that on the resource hub. Rose, I'm right in thinking that these resources and the webinar, the slides and everything will be included on the resource page?
Yes, yeah, they'll be added to the Primary Care Board website when they're available, and we'll get in touch with everyone who's attended today with the link, so you can go on and share those with your colleagues as well when they're ready.
Hello. I was just wanting to ask about the studies which have shown evidence of respiratory distress in teenagers who vape. What are the current studies showing? Like, how often do children have to vape for this to happen?
I can take half of this, then Alice might want to jump in. I think, again, I'm going to caveat it, and I know it's a really annoying caveat that we don't have extensive research yet on it, and it also varies completely from young person to young person. So I see young people who have maybe vaped only a few times and they experience kind of what they describe as respiratory issues, particularly if they have asthma, or I have young people that have vaped kind of since a very, very young age with no symptoms as well. So it's hard to put a particular kind of numerical figure on like how much they have to use for it to kind of be impacting them. I don't know if Alice has got anything else to add on that.
Yeah, similar really. It's not necessarily linked to, I guess with most of the studies, it's not really the long-term follow-up's not necessarily there, which is why it is quite challenging to quantify, you know, if people vape for this long, then that's how long they'll have to vape for. So it's quite difficult really, but there's the physiological link between how it disrupts lung function, so that the gas inhaled causes that dysfunction, which then can contribute to asthma. I guess that's linked in all ages, really. But I guess watching Evelyn's video as well, her personal account is interesting about how she developed asthma.
If I can just jump in as well, I think one of the challenges that we do have is that in terms of kind of what the individual or young person is vaping as well. So we mentioned around legal and illegal kind of vapes, and I think, you know, it's possible that young people could be vaping actually something that is illegal or illicit that doesn't meet the requirements that is banned. So actually the test, a lot of the evidence is around kind of legal kind of vapes as well. So that long-term evidence around illicit vapes, because obviously they are illegal, hasn't taken place. And the challenge that we do have is that is illegal vapes. So young people could not knowingly be vaping legal vapes, and the chemicals, as we mentioned, are kind of quite different in that. So therefore, it's very hard to kind of predict in terms of those respiratory outcomes because that evidence isn't there as well. So I think that's a really important point to know that. And we've had it with adults as well. They've not known that actually they're vaping, what they are vaping is illegal. So we do always kind of recommend to use reputable providers as well. And that's the most kind of important kind of section. And Amy shared kind of the kind of key markers around illegal vape and also legal kind of vaping products like the liquids as well. And that's really, really important.
Okay, thank you.
No worries. I've just seen we've got another question in the chat from Priya. Are there any major health emergencies or deaths linked? Again, this is a really tricky question to answer, and it completely depends on the substance. I think it's important to mention as well at this point that a lot of young people get their information from social media. So kind of myth busting is a big part of what I do as well. And we see kind of the phrase popcorn lung thrown around quite a lot with my young people. We have, with the THC vapes, we've seen an increasing number of young people hospitalized, resulting from using a THC vape which they don't know what's in it, or overdosing on it because they weren't aware of how strong it was. We have seen a rise in that. Luckily now we are being able to kind of educate our young people, so the education is now catching up, so they're a little bit more clued up on what's in it and able to kind of react according to that. A few years ago, there was a health scare in the States relating to some hospitalizations and some deaths with some illicit vapes. That was a very small batch of contaminated vapes, and we've not seen anything of the same scale since. But again, it kind of depends. If a young person has asthma, that's obviously increases the risk of them having an asthma attack, which is considered a medical emergency. So we're not seeing anything kind of super prevalent in terms of like ongoing medical emergencies, aside from the increase of THC hospitalizations. Hopefully that answers your question. I know it's a little bit vague and I'm sorry about that.
I guess something important to think about as well is, especially with links to mental health concerns, a lot of these things are so multifactorial that it's really hard to specifically link them to vape effects themselves, especially in the research. So that's something to be aware of, I guess. But yeah, there is increasing stuff to link it to that. So I guess just be critical with anything you're reading and that as well. But yeah.
Got any other questions or feedback about what you've seen in clinic? We are learning from you guys just as much as you're learning from us as well. Stuart?
Well, yeah, I'm sorry. This is my second bite at the cherry. This is an observation. Quite a lot of the discussions I have with patients, particularly younger ones, absolutely fit in. So I'm somewhat reassured by what you've told me. I've not been misleading people with this thing. But what I've found really useful is that you've given me a lot of statistics. I've taken nearly 3 pages of notes of things I've written down. So instead of sort of a vague thing like the vicar saying that sin is bad, you've allowed me to tell people, and a lot of these young people are intelligent and they take these things on board, and it's really useful to be able to give them the facts in the way that they can do. So thank you for that.
No worries. I'm glad that you found that helpful. And absolutely, when we kind of preach to the choir, so to speak, that young people it doesn't resonate with them. And I think particularly because they are so used to being told, do this, don't do this, especially as a teenager, being able to be like, look, here's the evidence, this is the advice. You do with that, let them sit with it. That's actually when we get the most effective results, because we're not chastising them, but we're able to empower them with that information. And I think that perspective is a really useful one to take into clinic. So thanks, Stuart.
There's no more questions. I don't know. This is a kind of a nice, I suppose, kind of ending to close now, and just to say thank you to everybody. Especially thanks to kind of Amy and Alice as well for their presentation, and thank you to everybody for joining us, and do complete the evaluation form. I don't know whether Don, you've got any final words?
I was just going to repeat what you've just said there, actually. Just thanks to all of you. I think that's been an excellent presentation. I hope it's been informative. It's been very informative for me. And as I said before, please share the resource with the rest of the team. And I'm presuming that you're open to any dialogue with any people who've been on the call today going forward, and hopefully be able to use the contact on the slide. So are the slides going to be made available as well for the people who've been on the actual call today, Rose, or is it just going to go straight onto the website?
We'll share the slides with everyone who's been on the call today.
Okay.
Yeah, no, that's fine. And then on the website we'll have the recording of today's webinar, and then the additional resources that Naira has collated with all of the information for the specific localities as well.
That's brilliant. So just thanks again, everybody, and thanks everybody else for attending. I know you've given up an hour and a half of your time, and that's very much appreciated. I hope it's all been very educational for you. So thank you very much to everybody.
Thanks, everyone.
Thank you.
Thank you.